guys, welcome back to the Nurse Preceptor channel on YouTube. This is Hillary. I am your Nurse Preceptor for today, and we're going to talk today about how to give an intramuscular or an IM injection or shot. There are a number of different drugs that can be given through an intramuscular injection, and I'm going to use my skin dummy that I've used before to show you a few different things. So this is a model of skin. This would be your skin or your dermis. This would be your fat layer or subcutaneous layer. And then this is the muscle. This is supposed to be the muscle of my dummy, and this is where we want the medicine to go in this case. Typically, medicines that are injected into an intramuscular route are drugs that are either very caustic or irritating if they're given into the subcutaneous layer. They're drugs that don't absorb well in the subcutaneous layer. So the muscles are a good place to inject. You have a lot of blood flow through the muscle, hence the red color that's in your muscle. So what we're going to be doing is using a needle that is a little bit longer than the one that I had in the subcutaneous shot video. And when we give this injection, it's going to go all the way into the muscle. And you want to use a needle that is a big enough diameter that it's actually going to be able to go into that thick muscle without breaking off, and one that's long enough without being excessively long. On your really heavy patients that have a lot more fat tissue, you're going to need a longer needle, about 1.5 inches or even a 2-inch needle. For your kind of, let's say, average BMI patient, about 1-inch needle should suffice. You can use 1.5 inches, especially if you're going into the gluteal muscle, which is a little bit thicker and it has a little more fat tissue over it. Where can you give an intramuscular injection? So on adults who have plenty of muscle mass, or even teens that have plenty of muscle mass, you can use the deltoid muscle of the arm, and you want to shoot for about 2 finger widths below the shoulder. Okay, so right there, kind of high up on the arm. And the other places you can use are the top of the thigh, the side of the thigh, and a lot of times we use those in kids. And then there's also the gluteal muscle that is, let me stand up for a second. The gluteal muscle is right back here. Okay, just right under the waistband. It's a little trickier to administer because there are some nerves that run kind of close to the surface back there. You want to make sure that whatever you're injecting, you have the proper amount in your syringe. You want to wash your hands, okay, or use your hand sanitizer. And we're going to get some gloves on. Because if we're injecting someone other than ourselves, we don't want to be exposed to their blood. And I just really advocate, keeps you safe, keeps them safe. It's a win-win. Okay, so we put our gloves on. And I'm going to demonstrate this on the dummy for you. So the other thing we need to have is an alcohol pad or some kind of a prep pad that we can use to disinfect the injection surface, because anything you're putting through the skin, any kind of bacteria, could potentially be dangerous if it got into the bloodstream. So we're going to clean it really aggressively, just scrub, 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 try to clean all the surface bacteria off. The kindest thing you can ever do for your patient who you're injecting is to let that alcohol dry for a minute, because it really stings. What you want to do is kind of feel the muscle and know about where you're going to aim for. And what I like to do is kind of give them a few little preparatory squeezes, kind of nice and easy. Or if it's the glute, just one big squeeze. You want to make sure you've got your cap off the needle, okay? And with this kind of injection, we're actually going to go straight in at a 90-degree angle. I do a one-handed technique. We're going to go 1, 2, 3, kind of dart-like, just go in, commit to it. I pull up on that flange, and what you're looking for is blood flashback. If there is no blood in that syringe, you are good to go, and you're going to kind of count it out. 1, 2, 3, and we're done. And pull that out away. Make sure that you're not ever aiming that needle back at yourself. If you're at a hospital or health care facility where they have the safety needles, you can just use whatever device they have to click over the needle, so that basically you're not carrying around a sharp needle looking to stab yourself or someone else, because that really would not be an ideal situation. There's a lot of paperwork involved if you stick yourself with a needle. What I usually do is just hold some gentle pressure with a cotton pad and then put a Band-Aid over it so it doesn't leak out. And typically I have not found that in general they bleed much at all. If you take your time and kind of poke around, oh, it's going to hurt. It's going to hurt like crazy, and you don't want to do that to your patients. All right, so that's how you do an intramuscular injection. If you have any questions, please let me know. And thanks for tuning in. Bye.